I missed track the purpose viral upper tract infections.
Yes. Now I'm muting you. You will not talk anything because I don't want any background sound also. So because I have to concentrate, when you have something, then I will ask if I have any doubts, I open and I'll continue. Right. Because I want you to focus on what I'm showing you. Okay. Right. Using the information given, write a letter of reference to Dr. A. Mole in the emergency department at the South Cottingham Children's Hospital. So this is a children's specialist. Dr. A. Mole, children's specialist. Children's specialist. Emergency department. So this is a child. So he's a children's specialist. Yeah. So urgent letter, emergency. Emergency department, South Cottingham Children's Hospital. South Cottingham. Okay. So the address will be like this. Okay. Dr. A. Mole, emergency department. South Cottingham Children's Hospital. South Cottingham. Okay. Children's specialist. So Dr. A. Mole, children's specialist. Okay. Emergency department, South Cottingham Children's Hospital, South Cottingham. That's it. Fine. This is the address. Okay, fine. Dr. A. Mole, emergency department. Beautiful handwriting. South Cottingham. 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 So this is spelling mistake. Okay. Spelling mistake. It is not Cottingham. It is Cottingham. Cottingham. And it is not Children's Hospital. It is Children's Hospital. You have to see very carefully what is given. Children's Hospital. So you did not write Children's Hospital. CHILDREN apostrophe S. That is what is right. Children's Hospitals. And next one. That's South Cottingham. Okay, 10 April 2023. So 2013. Dear Dr. Mole, comma should be immediately. Should not leave this much space. You should not leave so much space. Comma should be immediately. No space before a comma. No space. No space before a comma. Okay. No space before a comma. Should not leave. No need. No need of space. No need space before a comma. So we can say unnecessary space. Space before a comma. regarding, here also problem, no need space before a column, unnecessary space before a column, no need space, not required, regarding, here space required after column, space required, space necessary after the column. Okay. Unnecessary capital letter, unnecessary space. So Kelsie Jennings, aged 10 years. 10 years is not required. Age means understood. Normally aged is years only. These months or days, that is different. Okay. So it should be a small letter. Age should be small letter. Aged 10, that is enough. No need years. Unnecessary capital letters after a comma. Unnecessary capital A. Unnecessary capitalization. Not necessary. Thank you for urgent assessment and management of Kelsie. A 10-year-old lady. 10-year-old lady? How can you say lady? 10-year-old. It's not right. 10-year-old girl, you can say. Child, you can say. Lady. Lady is above 18 years of age. Okay. A woman, a lady. All right. That's it. Thank you for urgent assessment and management. So don't write like this. This okay, this is correct only. This is correct only. Okay, this is not wrong, but quality is not excellent. Quality is not excellent. Quality is not excellent. Quality should be excellent. Okay. Quality should be excellent. So you have to improve the quality there. So how you have to do is start with Kelsie. Kelsie, a 10-year-old girl, a child, a girl, 10-year-old girl. Okay, 10-year-old girl. 1 second, please. So this is fine. There is no problem with this. But you can start with Kelsie. Kelsie, a 10-year-old girl or child. Girl also is okay. Child is better. 10-year-old girl, child or female girl or female child. That much is not necessary actually. Kelsie, name is understood that she is a child. Okay, aged 10 means child. So no need to say all these things. So 10-year-old, aged 10 is already there. So this is repetition, that's all. Avoid repetition. Avoid repetition. This is correct. I'm not saying it is wrong, but it is repeated. A 10-year-old child. 10 year means child only. It's understood. It is redundant. Redundant. Okay. Redundant. Now I'm unmuting you for 1 second. Hello, Rachel. Hello, Rachel. Can you unmute? Yeah.
Yes.
I'm giving you quality. Do you want me to correct or do you want me to give quality?
Goes of it.
Yeah,
If you don't
that's what
mind.
I'm telling. See, Now here, this is correct. I'm muting you back. Very good. Thank you for answer. Now here, the point is, you already told aged 10. Then no need of repeating the same thing again here. A 10-year-old, this is not necessary. Okay, this is not necessary. Okay, this much is not necessary. So lady is a mistake, it's a child. Okay. So 10-year-old is not necessary because you have already introduced here aged 10. So age you have already mentioned. So why are you mentioning? Any one time. See, this is called avoid repetition. Avoid repetition. Use variation if you want. Don't repeat anything. Don't repeat. Never repeat anything. Okay. Kelsie. Okay. So Kelsie, comma, whose feature? Only single feature. So features. Whose features? Whose features are consistent with severe asthma induced by viral upper respiratory infection. Viral upper respiratory infection. So, thank you for urgent. Thank you for urgent assessment and management of Kelsie, a 10-year-old child whose features. So features, FEATURES, features. Okay, whose features? Here, features, not feature, features are consistent with severe, SEVERE, severe asthma induced by viral upper respiratory infection. So thank you for, okay. Kelsie, comma, whose features are consistent with asthma induced by viral upper respiratory infection requires, or is this a referral letter or a discharge letter? You have to know. So this write a letter of referral. So you are writing a letter of referral. So this is a referral letter. You're writing a referral letter. So is being referred for urgent assessment. So where will I write? Okay, here only I will write. Yeah. Jennings, Kelsie, comma, whose features are consistent with severe asthma. Okay. Induced by viral upper respiratory URTI, upper respiratory tract infection, comma, is being referred for urgent assessment and is being referred for urgent assessment and is being referred for urgent assessment and appropriate management. Okay, that is done. So here you can write like this. I'm making space for you. Okay. Now, oh, Kelsie, whose okay, Kelsie, whose features are consistent with severe asthma induced by viral upper respiratory tract infection. Okay, respiratory tract infection. Okay, comma, is being referred for urgent assessment and appropriate management. Okay, Dr. Altayeb. Rachel. Hello, Rachel.
Yeah.
Is that clear?
Yes, clear for me.
Do you feel that this quality is better than what you have
Of
done?
course. Yeah.
Huh?
Obvious.
Because next time you will not struggle for this. Once you learn the style, next time it will be easy for you.
Yes, sir.
There is no repetition. There is no unnecessary. There is no personal. There are no personal pronouns. There are no active voice sentences. There are no nonsense. There are no just like that. Finished. That's very good now. Okay.
Yes.
What you have written is also correct. There is no mistake in that one. But repetition is there. Active voice is there. You, I, personal pronouns are there. Okay.
Yes.
And referring, the word refer is not there. So there are some drawbacks. Sentence is correct, but the quality is very low. I made it very high. Okay.
Okay. Yes,
So
clear
try
for me.
to apply this style in your next letters. You can write any style. You can change. No problem. That's not compulsory that you have to follow this one. Whichever you feel, change and adapt and write. No problem. Okay. Every time I'll give you new styles. You can adapt everything. Okay. So that is done. Next one. On today's visit, Kelsie presented with a 2-day history. No, this is wrong. With first one is it is a history. So you have to say A. You have to say A history. A history. That is how it is. A history, and in between comes today. 2-day. A 2-day history of. Like this you have to write. With a 2-day history, a history for 2 days. That's the meaning. A 2-day history. Hyphenated. A 2-day history. Here also 10-year-old, like that one. Here also compound adjective. A 2-day history of wheezing, not wheeze, wheezing. Now, okay, wheezing you can say of wheezing. Wheezing is the gerund. Wheeze is the noun. Spelling, that also spelling. E is missing here. Spelling mistake. Wheeze should be WHEEZE. So you have to improve spelling. Wheezing and shortness of breath. Shortness of breath associated with fever. Comma should be immediately. Runny nose and loss of appetite. That's good. Full stop. See, you are leaving this side same space, this side same space. No, this side no space is required. Space is not required before full stop. No space before full stop. No space before full stop. Here also no space before fever. Okay. No space before fever. Runny nose and loss of appetite. In addition, to is not needed. In addition to that is not necessary. In addition, that's enough. She has difficulty in breathing, requiring the use of accessory muscles. Okay. She has. Avoid using she. Okay. Remove she has. Remove to. Okay. Remove she has. So, in addition, difficulty in breathing, requiring the use of accessory muscles, has been observed or has been reported, has been noticed. Passive voice. Accessory muscles has been mentioned. If they told you, mentioned, reported, informed. If you have noticed, observed, noticed, like that one you can say. Has been noticed. Okay, like that. On examining, okay, has been reported. Okay, has been reported, you can say there. Okay, because you told after on examination, next, so that you can say. On examination, no space before comma. Before comma, no space. After comma space, on examination, there is inflamed throat. Inflamed throat and widespread wheeze. Widespread wheeze on chest auscultation. Auscultation, spelling mistake. You wrote auscultation. It's not auscultation, it is auscultation. Okay, here wheeze spelling you have written correct. Widespread is one word. Widespread is one word. Widespread is one word. Okay, there is no need. On examination, inflamed, single M or double M? Inflamed. Okay, what is inflamed spelling? Inflammatory, double M. But inflamed is single M or double M? Inflamed. Inflamed is single M. Okay. Inflammation is double M. Inflammable, inflammation, inflammatory, this is double M. But inflamed is single M. Inflamed, single M. So that is a mistake. So inflamed is single M. Inflamed throat. On examination, inflamed throat and widespread wheeze on chest auscultation. Auscultation, spelling mistake again. AUSCULTATION. Your TA is missing. Your auscultation is not there in the Cambridge dictionary. Okay. Auscultation is not there in the Cambridge dictionary. Okay, we'll ask the Google. Okay. Google, yeah. This is a medical Oxford dictionaries. Okay, learn more now. This is from where we don't know, but we got one definition here. Okay. So medium plus auscultation. Here it is. Okay, this is the spelling. This is the spelling. Okay. Auscultation is the spelling is this. TA is missing on chest auscultation. Inflamed throat and widespread wheeze. Widespread. Widespread is one word or two words. You wrote two words. Widespread. WIDES. Wide. Okay, why I am doing in Google? Here. WIDESPR. Widespread is one word. One word or two word. It is a mistake. It is a mistake you don't know. So this is C1 word. Ordinary people cannot know. If you don't know this word, that means you are ordinary person. If you know this word, you are extraordinary person. Now you know. This is what is transformation. Okay, Altayeb. 1 minute. The name Rachel. Rachel.
Yes.
Okay, sorry. Unmute. Unmute, please.
Yes, sir.
Yeah. See, earlier you did not know. That means you are ordinary student. Now you are special student. You understand now?
Yes, I got it.
Earlier you don't know.
Yes.
Word wide separate, spread you wrote separate. But it is not separate. Widespread is one word. It's a very special word.
Yeah,
if you can
but
write it properly, you will get a B+.
But the line, it ended in the line. Why?
Line is
So
not
what I
also
put
right.
as-
Hyphen.
I
Put
put
a hyphen.
hyphen, yeah? Yeah.
Put a hyphen.
I put it, but I think it's not clear.
Put a hyphen like this. Okay. You understand?
Yes, I got it.
Or you can write full word. Don't write here. Leave it. Line is not there. Forget this one.
Okay.
You don't know. Forget it. Actually, first thing is you know it or not. That is more important. Do you know it?
Yes, I know it's
So if
one.
you know it, then you should not write like that. That's it. So widespread you have to write here itself, one place. You write with a hyphen or write like this, widespread. Okay,
Yes.
finished, no problem. Nobody is going to bother you now. Okay, widespread reason chest palpitation on examination, inflamed throat and widespread wheeze on chest auscultation were observed, were noticed, were found. PEFR. What do you mean by PEFR? Do you know what is
big
PEFR?
Yes, big
Huh?
expiratory flow rate. Big expiratory flow rate. It is this abbreviation, is a short for.
Okay, can you tell me full form?
What?
Peak
expiratory flow
expiratory
rate. Flow rate.
Can you type a peak expiratory? Come
Yes.
on. Okay, type in the chat box. Peak expiratory. Sorry. Okay, first letter capital only. Peak expiratory. Peak expiratory.
Flow. F-L-O. Yeah.
Flow rate.
Yeah. Rate. Yes. That's it.
Write
No,
down like
without
this.
F. There is no F in the. Yeah. That's
Write like this.
Okay.
Peak expiratory flow rate is 140 liters per minute. Okay. Liters per minute. Finished. Full stop. So you have to write in full. Don't write like note form. In the question they will say, don't write like note form. You don't know that one here, see? At the bottom it will be written here. Don't use note form. Okay? In this statement it is not there. Down it is not there. So you don't use note form. Okay. Fine. Peak expiratory flow rate is 140 by liters per minute. Ventolin nebulizer immediately is commenced, but a minimal response is observed. Okay. Kelsie presented or Kelsie was presented? You cannot say Kelsie presented. Kelsie was presented because she is a 10-year-old child. She's a child. She cannot come on her own. So you have to say Kelsie was presented. Okay. So here also the point is there. But okay. So Kelsie was presented. Because she is a child. Somebody has to bring her. Kelsie was presented with a 2-day history. Okay, fine. That's finished. Ventolin nebulizer immediately is commenced. Ventolin nebulizer, 2-day visit, has been commenced immediately. Okay, has been commenced immediately. So Ventolin nebulizer, okay, has been commenced immediately. So you can say has been commenced. Has been commenced. Has been commenced immediately. Immediately. But immediately, but a minimal response. Response is spelling mistake. A minimal response, spelling mistake. R-E-S-P-O-N-S-E, response. Minimal response is observed. Is observed means present now. Is observed now. I observe means always. Is observed means always. So it's present simple, but it is universal. That means always. I play football means football is played means always. Not yesterday, today, tomorrow, anytime. That is the meaning. So you can say has been observed is better. But a minimal response has been observed, not is observed. Instead of is observed, you can say has been observed. Tense, present perfect is better. Has been observed. Finished that one. Finished. Has been finished. So what happening is simple present. So this is finished. So has been observed. Very good. Kelsie had multiple to our clinic. Multiple to our clinic. What do you mean by multiple to our clinic? Multiple visits or what?
Yeah, there is a visit. That's
Yeah. Kelsie had multiple something. I don't know what you meant here. So here that is
visit. Yes.
okay. Multiple visits. So that is multiple visits. Maybe that is what you want. Kelsie had multiple visits. Our clinic with viral trigger V's on the last few months. Viral trigger V's during the last, not on the last, or in the last or during the last, for the last few months, during the last few months, during the last few months, or for the last few months, or in the last few months. Okay, for the last, during the last few months. Okay, Kelsie had multiple visits to our clinic with viral trigger. Viral trigger V's. What do you mean by this viral trigger V's? I did not get this one. Viral trigger V's. Here, viral trigger.
With
Okay,
it looks like induced.
Viral approaches with trigger V's. Okay, fine. Running nose patient returns with persistent not. Okay, right. Okay, exercise tolerant. Okay, fine. That's fine. Next one is on the during the on the 21st TH. What is TH? 21st means ST. But no need. Why do you want to write TH? Forget, na. Just write the date. No, don't write all these things. On, don't write the also. On 21 December 2012. That is enough. On 21 December 2012, comma, not full stop, comma. She was diagnosed with asthma. Was diagnosed. Why all this one? Asthma was diagnosed. Asthma, which was uncontrolled over 1 month, was diagnosed. Okay, asthma was asthma was diagnosed. Okay, asthma was diagnosed. Asthma was diagnosed. Okay. Okay. On December 2012, asthma was diagnosed. Okay. So you can eliminate this part. Okay. Asthma was diagnosed. Okay. Asthma, which was uncontrolled for 1 month, not over 1 month, for 1 month. Okay, for a month, for over a month, for over a month. Okay. But I don't think that is needed here. Okay. So as a result, instead of as a result, you can say consequently, one word. You're saving a word, consequently. As a result means you can say consequently. This is correct only, not wrong. I'm not saying it is wrong. Okay. I'm giving you improvement from B grade. Now this is not even B, this is C plus, something like that. C plus. In between C plus. Now I'm taking you to, if you improve all these things, it will go to B plus. This is okay, as a result is good, but consequently means as a result only. Consequently, inhaled corticosteroid decotype 200 grams 3 times per day was commenced. So inhaler, inhalation of, inhaling or inhalation of corticosteroid decotype 200 mg 3 times. 3 times, you can write thrice. Per day, you can write daily. Thrice daily. Why do you want to write 4 words? You can just say thrice daily. Thrice daily, finished. So instead of writing 4 words, you can write 2 words. You're saving, means less words, more quality. That is the meaning. 3 times is equal to thrice. Quality. Not everyone can write like that. So when you write like this, your quality improves. Okay, thrice daily was commenced. Okay, very good. Along with Ventolin spelling.
No E.
Ventolin I don't know. Just I will check, confirm. I know actually. Okay, I know actually. It's not I don't know. But so for when I teach, normally I show it to my students. So Ventolin is like this: Ventolin. That's all. Ventolin. Okay, Ventolin is here. So that's it. Ventolin. No E. So you have done another mistake here. So you have to be careful. Ventolin. Next time you write each word 10 times so that in the exam you don't write. Ventolin. Ventolin. Is it a brand name or generic name? So Ventolin is coming in between also, it is capital letter. So it is a brand name then. Ventolin is a brand name. So let us ask Google, Ventolin brand name or generic name. Ventolin brand name or generic name. Okay. Albuterol is the generic name. Albuterol is the generic name. Ventolin, okay. Ventolin is a brand name. Ventolin, 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 Ventolin. All these are brand names. These are brand names, different brand names. And the generic name is albuterol. When you are writing albuterol, you should write small letter. When you write albuterol is generic, you should write small letter. But when you write Ventolin, you have to use albuterol, the generic version of Ventolin. So Ventolin should be capital letter. But albuterol, when it comes in between, anywhere it comes, it will be small letter. Ventolin, anywhere it comes, it is okay. Now you understand what is the difference between generic name and brand name, you Rachel? Dr. Rachel from the United Kingdom.
Yes.
You understand now? Okay. So you have to be very careful with the generic name and brand name. So this is a mistake if you write small letter. So you have to write capital letter now. You got the point, I think, along with Ventolin as a, what is this?
Sorry, this is a rescuer.
Rescue. Okay. So you have a spelling mistake here again. A rescue. A rescue meditation. Actually, two mistakes. A is separate, you have to write, but you joined along with this. It looks like they have joined A also here. So little space, you have to leave more space here. Rescue. So what is the spelling of rescue? Let us learn from the dictionary. What is the spelling of, okay, R-E-S-C-U-E. Okay. So dictionary says it is correct. Okay, fine. So rescue. So rescue medication. Okay, fine, that's it. Next, regarding to Kelsey's past medical history. Regarding Kelsey's medical history, not past. There is no question of past medical history. It's medical history. History means past only. What do you mean by history? History means the past of a person is called history. The past of a country is called history. History means past. What do you mean by history? History by itself, it is default. It means past. History. History means what? History means, okay, past events. Past events. It's understood that it is past. Then why are you saying past again? That means it becomes double past. What do you mean by that? It is redundant. No need. So regarding Kelsey's apostrophe S, this is also a mistake. Kelsey's apostrophe S. Kelsie apostrophe S. That is the problem there. Regarding Kelsey's medical history, comma, no space before comma. Next time I want all these things to be improved. Okay, lot of improvement is there. Yesterday I taught you 1.5 hours or even 2 hours, but today it came to 1 hour and 45 minutes. That's very fine. Okay, so she has no known allergies, but there is a strong family history of asthma. Okay, regarding Kelsey's medical history, despite, use the word despite. Despite is a good word. Despite, remove all this. Despite, despite no known allergies, despite no known allergies, comma, finished, but is not necessary now because we used despite. Okay, we don't want to use a she, that's why. We don't want to use she. What happened? Okay. So we don't need but now. Despite no known allergies, there is remove a strong family history of asthma has been okay reported or noted or mentioned. Finished. Asthma has been noted, reported, or mentioned. Okay. Registered, recorded, has been recorded. Okay. Has been recorded or registered. Okay. Noted down. Registered in her history. You would be grateful. Again, you wrote the spelling. Yesterday I taught you. Okay. Yesterday I taught you, but again you made a mistake. Okay. So what you did is you added E here, but you did not remove E here. That is the mistake. You did half correct, but grateful, grateful. That is the spelling. Write 10 times. If you had written 10 times, you would not have done this mistake again. It would be grateful if you evaluate Kelsey's condition and treat her promptly. Yours sincerely. Yes should be small letter. Yes should be small letter. And a doctor. Yes should be small letter. Is that clear?
Yeah, it's clear for me.
Are you happy with the feedback? I don't know. It is everything blue, and maybe you're angry or you're upset or you're wild with me. I don't mind because I want quality. Tomorrow you should go and tell everyone this is Simon sir's correction. You understand?
Yes. Yes, sir.
Now tell me, what do you feel about the feedback now? Are you happy?
Yeah, I'm so happy because I learned from my mistake. Mistake is people
okay.
get.
And this is short in length. You have to write some more, at least 4 lines here. Okay, 4 or 5 lines. Okay.
Okay.
So you have to select and think about what else you can write. So your letter should come at least till here. Till here. 1, 2, 3, 4, 5. Till here you have to write at least. Okay.
Okay.
Understood?
Yeah.
Okay, fine. This should go a little down. Right. Okay, then take care and send a letter today so that I can study and give you tomorrow. Okay. I don't think tomorrow you need 1 hour. It's just maybe 40 minutes, 45 minutes is enough, like how we did today. Okay. Is that clear?
Yes, be fine. Yes, okay. Clear.
And next week onwards, because you are improving, once you improve this week, next week you have to send 2 letters at a time. Okay.
Yeah, I'll do inshallah.
You understand? Otherwise, what is the use? No. Correct?
Yes.
I'll finish in 20 minutes. You are improving. 20 minutes you'll finish. What will I do with 1 letter? You send me 2 letters next week. Okay.
Yeah. I'll do.
Okay, fine. Okay, then. Any requirements, any doubts, you can ask me now.
No, thank you, sir. I appreciate your help.
Okay, dear. God bless you. God bless you. I'm going for my tea time. Okay.
You too.
Okay, bye. God bless you.
Yeah, have a good day.